I'm Kayla. I'll be performing medication administration. Ryan's the videographer and Emily is the evaluator. So we have our scenario. Jamie Wheeler was admitted from the skilled nursing facility yesterday. The patient has a past medical history of mild dementia, but the caregiver at the skilled nursing facility notified the provider that the patient was significantly more confused than usual. The patient has also recently become less mobile due to an exacerbation of rheumatoid arthritis. The provider has written orders for new medications to be given this morning. So we're going to check our provider orders that were given this morning with our medication administration record. The patient's name is Jamie Wheeler. Date of birth is 10/31/1947. He has a medication allergy to codeine. We're going to be given 3 medications. The first medication is erythromycin, 250 milligrams by mouth 4 times a day. This is the first time we're going to be given this medication today at 800 hours. Varicella vaccine will be given 0.5 milliliters subcutaneously. We'll be given that once and it will be administered this morning. We're also giving dexamethasone, 4 milligrams will be given intramuscularly. We're also going to be given that once this morning as well. So the provider's orders matches the medication administration record. So what we're going to do now is we're going to retrieve our medications from the Pyxis. So our first medication is erythromycin. That's an oral medication. So we've got erythromycin, 250 milligrams. It'll be given orally. It's a capsule, and it'll be given 4 times a day, but this is the first time we'll be giving it at 800 hours. So get a cup for it. And the expiration date is 10/20/37, so it is not expired yet. Our next medication is the varicella vaccine. Here's our varicella vaccine. We'll be given 1 dose per 0.5 milliliters. It will be administered subcutaneously 1 time this morning. The expiration date is 12/20/30. We'll be given that this morning as well. We're going to grab a syringe. Since we're given 0.5 milliliters, we'll use a 1 milliliter syringe. We're going to use an 18 gauge blunt fill needle to draw up the medication, and we will be using a 25 gauge 5/8 inch needle to administer the medication. Next, we'll be given dexamethasone. We're giving 4 milligrams per 1 milliliter, and it will be given intramuscularly, and this will only be given once this morning. We're going to select a 3 milliliter syringe to draw up the medication. We'll be using an 18 gauge blunt fill needle, and then we're going to change the needle to a 23 gauge 1 1/4 inch to administer the medication. So these are the medications I'm going to be given, and I have selected these in the medication administration room. So now I'm going to move down the hallway and check these again outside the patient's door. So we'll be checking erythromycin, 250 milligrams by mouth 4 times a day. This is the first time we are giving it at 800 hours. We're going to be given the varicella vaccine. We're given 0.5 milliliters, 1 dose. It will be administered subcutaneously 1 time this morning. We'll be giving dexamethasone, 4 milligrams by 1 milliliter. This will be given intramuscularly 1 time this morning. Again, we're checking the patient's name, Jamie Wheeler, and his date of birth, 10/31/1947. So I've got my medications, and I'm going to now enter the patient's room. Good morning, Mr. Wheeler. My name is Kayla. I'm going to be your student nurse today. I'm going to perform hand hygiene and ensure patient has privacy. We have provider orders to administer your medications this morning. We're going to be giving you 3 medications. Before we give you those, can you tell me your name and date of birth? He says his name is Jamie Wheeler. His date of birth is 10/31/1947, and we're going to check that with our medication record. Jamie Wheeler, date of birth 10/31/1947. Mr. Wheeler, I see that you have an allergy band on. Can you tell me what medications you are allergic to? he says he's allergic to codeine. We check that with our medication administration record that also says codeine. Mr. Wheeler, we're not administering codeine today, so we should be good for your medication allergies. Mr. Wheeler, we will be giving 3 medications today. The first medication that we're going to give you is an antibiotic, and this is going to be used to help with your confusion if you have an infection. So before we give this medication, we're going to assess for signs of infection. We'll assess vital signs, appearance of wound if there is one, sputum, urine, and stool samples, as well as white blood counts. And then common side effects of this medication are nausea and vomiting. So if you experience those after the medication is administered, please let me know. I'm going to go ahead and have him sit up so that I can give him the medication. Mr. Wheeler, have you been able to swallow since you've been admitted to the hospital? He says yes, he has. And so to check his swallowing ability, I'll have him take a sip of water. Go ahead and take a sip of water for me, Mr. Wheeler. And he does well with that. So we know that his swallowing capability is intact. So before we give it again, we're going to check erythromycin, 250 milligrams by mouth 4 times a day, the first time being at 800 hours, which is right now. Okay, Mr. Wheeler, here is your erythromycin. Again, if you have any nausea or vomiting associated with this after you take it, please let me know. So there's that for you. Go ahead and swallow that for me. And I want you to drink this entire glass of water with it. Mr. Wheeler takes his entire medication. And then we get rid of. All right, Mr. Wheeler, we're going to give you a steroid injection to help your rheumatoid arthritis. And the name of this medication is dexamethasone. We're going to be given 4 milligrams and we'll administer it intramuscularly. So let's get some alcohol swabs. Okay. Dexamethasone, we're going to use a 3 milliliter syringe since we will be giving 1 milliliter of this medication. Top off. We're going to clean the top with an alcohol swab. Okay, we're going to draw up 1 milliliter of air into our syringe before we inject the medication into the vial. So we've got 1 milliliter. Okay, push the air into the vial. Then we're going to draw it up at eye level. So 1 milliliter medication. There we go. Any air bubbles? Okay. We're going to be giving 1 milliliter of that. We're going to recap this needle. And we're going to change out our needle. Put that in the sharps container. We're going to be using our 23 gauge needle. That's 1 1/4 inch to administer it. Because this medication is given intramuscularly, we're going to choose the deltoid to administer this medication. Okay, Mr. Wheeler, let me take a look at your right shoulder. And I'm assessing the skin integrity here. His skin integrity is intact, so we are good to give this medication there. I'm going to find his acromion process. I have found it. I'm going to place 2 fingers below it. I'm going to make a V with my other hand, and I'm going to administer the medication in the middle of that area. I'm going to clean the area with an alcohol swab. Okay. All right, and I will be administering the IM injection at 90 degrees. I'll provide Z traction All right, Mr. Wheeler, little stick. 1, 2, 3. And I'll administer the medication slowly. And then I'm going to hold it for 10 seconds. 4, 5, 6, 7, 8, 9, 10. Remove my needle. Engage the safety. We're going to dispose of this in a sharps container. We're going to hold a little pressure, but we're not going to massage the area. Okay. We're going to give one more medication for you, Mr. Wheeler, and this is a vaccine. It's called a varicella vaccine, and it's to prevent chickenpox. Have you ever had this vaccine before? He says no, he has not. And are you sensitive to any type of vaccines that you've ever been given before? He says no, he has not. So common side effects for this medication are a sore arm from the injection, fever, redness, or rash where the shot was administered. So if you have any of those side effects, please let me know. So we're going to check with our MAR, our medication, varicella vaccine, 0.5 milliliters that will be given subcutaneously. Okay. So we'll be using a 1 milliliter syringe to draw up the medication, and we'll be using an 18 gauge blunt fill needle to also draw up the medication, and then we'll change our needle to administer it. Okay, we're going to remove the lid, and we're going to clean the top of the alcohol. Okay, since we're given 0.5 milliliters, we will draw 0.5 milliliters of air into our syringe. Okay, and then we're going to administer that. I'm going to inject the air to the syringe and then draw up the medication. Okay. So we've drawn up 0.5 milliliters of the medication. We're going to get any air bubbles out. We're going to recap our needle we used to draw up with. And then we're going to change out our needle. Put that in the sharps container. We're going to be using a 25 gauge needle that is 5/8 inches. Typically we would administer this vaccine in the back of the arm, but today we're going to be administering it subcutaneously in the abdomen. Okay, Mr. Wheeler, I'm going to lay you down. Assess the skin integrity of his abdomen. His skin integrity is intact. I'm going to put some gloves on. We are going to administer this medication 2 inches away from the umbilicus. We're going to inject the medication at a 45 to 90 degree angle. So 2 inches away. We're going to clean the area with alcohol. Okay. We're going to pinch the skin. Okay. Regret it, it's going to be a little stick and a little sting. 1, 2, 3. We're going to inject the medication slowly and then hold for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. We're going to remove the needle, let the skin go, engage our safety, and put it in the sharps container. Okay, Mr. Wheeler, you did very good today. That's all the medications I have for you this morning. I will be back to give you your erythromycin later this afternoon. If you have any of the side effects that I discussed with you previously, please let me know. I'm going to go ahead and give you your call light and put your bed down in the lowest position with the side rails up. And then we are expecting the outcomes to be improved rheumatoid arthritis and less confusion due to the antibiotic that we administered today. All right, Mr. Wheeler, if you just call us if you need us. We will be around. I'm gonna exit the patient room, perform hand hygiene, and then I'm gonna document the dose, time, and route in my medication administration record.